Good morning everyone, Chris from the Headache and Pain Management Centre, and today we are talking a little bit of a different topic today, and that topic today is bursitis. And bursitis is a really common diagnosis for hip and shoulder pain. If you have bursitis, it can be really painful, and thought I'd dispel a few myths and give a few facts about how bursitis operates when it regards to pain. If you're here joining me, type in underneath, say hello, and as always, if there's any questions, more than happy to answer them for you. So when it comes to bursitis, basically people get diagnosed with bursitis when they come in and present with to GPs with either hip pain or shoulder pain. So when you get shoulder pain, typically you get shoulder pain at the front of the shoulder here. And one of the more common things that a doctor will ask you to do is to go, well, go and get an ultrasound on that. Let's see what's going on in there to see if there's any issues with the tendon or any issues with the bursa. G'day there, nice to see you, good morning. So when they often come back with the ultrasound results, it comes up with a word that says bursitis. Okay, it sometimes says subacromial bursitis. And the same as in the hip, if you've got pain right on the edge of your hip, so out on the point of your hip, sort of out to the side, you can't lie on it, it gets really painful after doing any length of walking, often you can be diagnosed with what's called a trochanteric bursitis because it's talking about where the bursa is. Now here's the upshot. When it comes to bursas, basically what bursas are little sacs of fluid, if you like, that sort of reduce friction between the tendon and whatever's underneath. It's usually a bone. So when you have bursitis, you look at it and you've got the pain in your shoulder, and this bursitis there, so it's an inflamed bursa. That's what it is. So it's a bursa that's inflamed. Now here's the thing. When it comes to bursitis, it's usually the tip of the iceberg. So when people often get bursitis, one of the biggest mistakes that they make is to go and get a cortisone injection into it. So to get a shot into the shoulder or into the hip to make the bursitis feel better, and it helps with the pain. Here's the problem. What happens is that you get the injection to the bursa, and a lot of the time, and I'm talking close to 100% of the time, what happens is that the bursa, it actually gets better because the bursa gets injected with some cortisone, gets injected with some local anesthetic, so it takes the pain away. But within a few days and sometimes a week or two, the pain comes back. And once again, we've got the same pain as we had before, so in the front of the shoulder or in the side of the hip. We've seen lots of patients over the years, and certainly in my career, particularly patients that have gone through work cover, and we're talking sort of occupations like nurses, occupations that sort of use repetitive strain, sort of using their arm a lot. Being diagnosed with these bursitis that just don't get any better. That this pain in the shoulder just keeps going on and on and on, and there's not much that they can do to help, so they just keep jabbing it, thinking that it's going to get better. But the fact is it's not, because the bursa itself is actually the tip of the iceberg, and it's the thing that hurts after a few things that are happening behind the scenes aren't going right. And typically what that is it's two things. Firstly, it's the activation of trigger points in the muscles of the shoulder and the hip. So in the shoulder, it's the muscles behind the shoulder blade, which are called your rotator cuff, and in particular, a muscle called infraspinatus, which is the biggest muscle that moves your shoulder from behind. And the second one is a lack of strength in the muscles that are actually moving the hip and shoulder together. So in the rotator cuff when it comes to shoulders, or in the glutes when it comes to hips. And of course, what can happen this can actually be also a result of something happening either in your neck when it comes to your shoulder, or in your back when it comes to your hip, because obviously it works in a chain. So if you've got something wrong with your back, say the back muscles aren't as strong as what they should be, the back joints aren't moving as well as they should be, then the load goes through your hips. And if your hip muscles aren't as strong, then it's going to use a way to keep moving. And quite often it's the bursa which cops it, because the bursa is where the tendon joins in and it starts to rub under the bone and gets inflamed. And the way to solve that is to get the muscles actually moving nicely again. Okay, so getting rid of those trigger points, bit of massage, trigger point release, often dry needling can do a really good job with that. And secondly, getting some good strength work into the muscles in and around the hip and shoulder to actually take that stress off the bursa so it's not being inflamed. You're not getting that really nasty localized pain right in the shoulder or in the side of the hip. So this is the thing, when it comes to bursitis, it can often be a misnomer. It can cop the blame for a lot of different types of pain. And we think because it's inflamed, it just needs some anti-inflammatories or some steroids or cortisone or local anaesthetic to actually knock the pain over. But the fact of the matter is it's usually the tip of the iceberg. There's usually something going on, grumbling behind the scenes. Usually that lack of strength in the muscles around the shoulder or the hip, or secondly, the trigger points which are actually pulling on the tendon which overlies the bursa, which irritates it and causes that to happen. So if you do have bursitis, that's a better question. If you've actually got pain in your shoulder or in your hip, it's not getting any better, and you've been diagnosed with bursitis, the best thing to do is actually to get that checked out to see what's going on in the adjacent muscles and also the adjacent joints. So if it's your hip, having your back checked out, and if it's your shoulder, getting your neck checked out, because quite often they can work in a chain and cause the bursa to be inflamed, causing that pain, and then you get stumped when it gets cortisoned and it doesn't get better. So you need to treat the muscles and the joints that are all around it to get the pain under control. I hope that's been helpful. If there's anyone that you know that has shoulder or hip bursitis, that has that shoulder or hip pain that isn't getting any better, feel free to drop us a line. Put the comment in the comments below about the person who's there. Feel free to ask questions. I'll happily touch base with you personally over private message to talk about all of that with you. Hope that's been helpful, and we'll be back again later in this week. Actually, there's a special video coming later in the week on Friday where I'll be reporting from Sydney with a couple of colleagues I'm meeting down there with a couple of things. We're going to a clinic who is starting up a bit of a headache type treatment in Western Sydney, so we'll be talking to them about their experiences with that. We'll talk soon, and bye for now.